surgical practice which has been in use for thousands of years and is still an essential part of the majority of today's surgical procedures. Although commonplace, it is essential that there is some understanding of the role of sutures in wound healing, the difference between suture materials, and their relative performance characteristics. Incised tissues must be held in apposition until the healing process has endowed the wound with sufficient strength to withstand stress without mechanical support. The appropriate use of sutures reduces the amount of connective tissue needed to repair the wound in the normal healing process, minimizes the size of the resultant scar, and accelerates the healing process itself. We can define a suture as a strand of material used to approximate or to ligate tissues. Since Lord Moynihan's definition of the ideal suture in 1912, it has been accepted that his criteria represented an impossible dream. However, advances in suture material technology over the years and in more recent times, new developments in absorbable suture technology are bringing the concept of the ideal suture ever closer. Because the ideal all-purpose suture still does not exist, the surgeon must select a suture that is at least as close to the ideal as possible and provides the suture qualities shown in the chart. Sutures are now available which can be matched to the healing process of individual tissues and the requirements of specific procedures, allowing the surgeon to choose the suture best suited to achieve the aim of uneventful wound healing. We can categorize the many types of suture materials available by reviewing the three major characteristics of any suture material. These are whether the material is absorbable or non-absorbable, constructed as a monofilament or a multifilament material, made from a natural or a synthetic source. The main advantage of an absorbable material is that no foreign body is left permanently in the patient to give rise to long-term problems. An absorbable suture must retain its strength long enough to provide wound support until the healing tissue is capable of surviving without that extra support. Therefore, its absorption must be predictable. Non-absorbable sutures are materials which are not broken down by the body, thus remaining in place permanently. Some non-absorbables can actually be broken down gradually, losing tensile strength. For example, nylon absorbs water over time and is weakened by this process, but the mass of the material is not absorbed or destroyed by the body. Silk is broken down by the body over a period of years, but is still considered to be non-absorbable. The disadvantage of non-absorbable sutures is that a foreign body is left in the patient, which can lead to long-term rejection problems. Sutures are also classified according to their structure. Monofilament sutures are made of a single strand of material. Because of their simplified structure, they encounter less resistance as they pass through tissue than multifilament suture material. They also resist harboring organisms which may cause suture line infection. These characteristics make monofilament sutures particularly well suited to vascular surgery. However, because of their construction, extreme care must be taken when handling or tying these sutures. Crushing or crimping can nick or create a weak spot in the strand. This could result in suture breakage. Multifilament sutures consist of several filaments or strands, twisted or braided together. This affords greater tensile strength, pliability, and flexibility. Multifilament sutures may also be coated to help them pass relatively smoothly through tissue, enhance handling characteristics, and minimize the risks associated with bacterial growth within the strand. Coated multifilament sutures are well suited to intestinal procedures. Synthetic absorbable suture materials, which closely resemble naturally occurring body substances, can be produced chemically. These can be absorbed without the tissue reactions often associated with natural fibres. The advantage of synthetic absorbable sutures is that they have very predictable strength retention and absorption profiles. In addition, they tend to be very strong materials which virtually eliminate the risk of adverse reactions. Synthetic non-absorbable sutures are relatively inert and when implanted induce only a minimal response by the body. This results in encapsulation of the material without adverse reactions. Occasionally, encapsulation may result in the suture being extruded or expelled by the body, especially if the supposedly non-absorbable material has started to fragment. Natural materials are those derived from naturally occurring sources, such as animal or plant tissues. Since the withdrawal of catgut and linen in many countries, natural sutures are now only available as non-absorbables in most of Europe. The most common form of natural material is now silk. The advantage of natural sutures is that they tend to be easier to handle and knot. The disadvantage is that they elicit a vigorous tissue reaction. It is not the intention to discuss wound healing in detail in this course. However, when choosing suture material, consideration should be given to those factors affecting wound healing time and the matching of suture materials to patients and the tissues being sutured. Whilst the stages of the wound healing process, from lag phase to proliferation, are common to most tissues, it should be remembered that individual tissues heal at different rates. It can be seen that some heal quickly, like bladder and bowel. Others are much slower, especially fascia, which has only regained 70% of its original strength after 1 year. Skin is slow healing, but it is thought that the high elastin content allows the early removal of sutures without wound breakdown. The diagram shows the variation in wound repair time for some commonly incised tissues. The rate of tissue healing, combined with the factors which affect wound healing, must influence the choice of suture material. Just as there are many factors to be considered in relation to the healing wound, there are many factors in the performance of absorbable sutures and their resulting contribution to successful wound healing. There are two aspects to consider: actual suture strength and how long is strength maintained. Suture strength is usually determined by its knot tensile strength, which is measured by the force which the suture strand can withstand at the point of knotting. The tensile strength of the tissue to be mended, i.e. its ability to withstand stress, should determine the size and tensile strength of the suturing material that the surgeon selects. The accepted rule is that the tensile strength of the suture need never exceed the tensile strength of the tissue. The second aspect to consider is how long this strength is actually maintained. It can be seen from the chart that just as tissues heal at different rates, suture materials retain strength and absorb at different rates. Therefore, the surgeon must now choose the most appropriate material for the tissues being sutured. Synthetic absorbable sutures are hydrolyzed, a process by which water gradually penetrates the suture filaments, causing the breakdown of the suture's polymer chain. This process means that the loss of tensile strength and the rate of absorption are separate phenomena, which are clearly demonstrated by the figures in the chart. A suture can have lost all its tensile strength and the tissue have healed, but potential adverse reactions are still possible until all the material has completely disappeared. It is therefore important to be aware of the time taken for the suture mass to be absorbed. As with any implanted foreign body, a suture material may elicit biological responses during the first post-operative week. While most materials will cause a mild reaction, synthetic materials tend to be less reactive than natural fibres. The chromic catgut sample shows extensive tissue reaction with an acute inflammatory response, but this is no longer in use. Contrast this with the minimal tissue reaction that occurs with polyglucaparone, which is a replacement for chromic catgut. Surgical eyeless needles are manufactured in a wide range of types, shapes, lengths and thicknesses. The choice of needle to be used must rest with the surgeon and may take into account several factors, such as the requirements of the specific procedure, the nature of the tissue to be sutured, the accessibility of the operative area, and the preferred techniques of each individual surgeon. The choice of needle shape is frequently governed by the accessibility of the tissue to be sutured, and normally the more confined the operative site, the greater the curvature required. The point profile of round-bodied needles is engineered to provide easy penetration of tissues. A flattened area is provided halfway between the point and the suture attachment. Positioning the needle holder in this area confers extra stability on the needle being held. The blunt taper point needle has been designed to minimize the risk of needle stick injury. The needle point is sharp enough to penetrate fascia and muscle, but not skin. This virtually eliminates accidental glove puncture. The taper cut needle combines the initial penetration of a cutting needle with the minimal trauma of a round-bodied needle. The cutting tip is limited to the point of the needle, which then tapers out to merge smoothly into a round cross-section. The conventional cutting needle has a triangular cross-section with the apex of the triangle on the inside of the needle curvature. The effective cutting edges are restricted to the front section of the needle and merge into a triangulated body, which continues for half its length. The body of the reverse cutting needle is also triangular in cross-section, but has the apical cutting edge on the outside of the needle curvature. This improves the strength of the needle and particularly increases its resistance to bending. The final decision on the choice of the most suitable suture material and needle combination rests on the careful consideration of a number of essential factors. The operation, access, and the type of tissue being approximated will determine the needle choice and the size of suture gauge to be selected. The tissues and their wound healing requirements will determine the choice of suture for any particular operative procedure. Other patient-related factors that may result in potential wound healing complications will further influence the choice of suture material.